Hi guys, welcome back to the channel. Happy Navratri to all. Hope you are enjoying this. We have finished with suppurative osteomyelitis. We'll be dealing with other types of osteomyelitis in our next classes. So today we'll be starting with chronic sclerosing osteomyelitis. Okay, let's start. Chronic sclerosing osteomyelitis, clinical presentation and pathogenesis. CSO is a sclerosing intramedullary bone infection caused by one of the actinomyces species. So it is a sclerosing condition in intramedullary bone. The hallmark of CSO, that is chronic sclerosing osteomyelitis, is persistent intense pain. तो ये जो पेन रहेगा वो इंटेंस रहेगा और persistent रहेगा. This is the hallmark of CSO. Now, periods of more intense pain, mild expansion of mandible, and even soft tissue swelling, which is known as active exacerbations, is also a features of CSO. But intense pain will be there, persistent. Mandible, the body angle and ramus area are mostly affected. It is tender to palpation, particularly at the buccal cortex, and there is no suppuration or drainage. In CSO, there is no suppuration or drainage. CSO is not known to occur in maxilla. So CSO doesn't occur in maxilla. It can occur at any age, but the peak onset age is in 20s. No racial predilection. The combination of actinomyces species and E. corridans produces a sclerosis. So we have seen this is a sclerotic condition. So these combination produces a sclerosis in bone, which is analogous to the fibrosis produced in soft tissue by these organisms. तो जैसे ये fibrosis करते हैं soft tissue में, वैसे ही they produces sclerosis in the bone. Port of entry may be via pulpal infection, endodontic therapy, or local hematogenous spread from the tonsil, pericornitis, or periodontal disease. So, either of them can be the port of entry. Coming to the differential diagnosis of CSO, first is diffuse sclerotic nature of a panoramic radiograph. ओके, इट शोज़ अ स्क्लेरोटिक डिफ्यूज स्क्लेरोटिक नेचर. तो वो जो डिफ्यूज स्क्लेरोटिक नेचर होगा ओपीजी में, वो और किस में दिखेगा. फर्स्ट द फाइब्रो ऑशियस डिजीज, ऑब्वियसली द पेजेस डिजीज. इफ ओल्डर देन 40 years, this can be the differential diagnosis. If it young, then it can be Gary's osteomyelitis or fibrous dysplasia can be the differential diagnosis. And osteosarcoma initially appears as diffuse sclerotic in panoramic radiograph. Now coming to radiographic findings. Panoramic radiograph shows poorly demarcated increased trabecular bone density. Diffusely involves alveolar bone, basilar bone and or ramus. And mandibular canal appear to be widened. These are the radiographic findings when seen on panoramic radiograph. Now, occlusal radiograph and axial CT scan are highly recommended. Characteristically, it shows a prominent endosteal sclerosis without prominent cortical bone loss, with minimal periosteal bone formation and often small radiographic dots representing focal area of bacterial collection. So the characteristic in the radiograph is the prominent endosteal sclerosis. What we see? Endosteal sclerosis. लेकिन cortical bone loss नहीं होता, only endosteal sclerosis होता है and minimal periosteal bone formation. So this is the characteristic. And sometimes a small radiographic dots are also noted which represent the focal area of bacterial collection. तो जो radiographic dots देखेंगे छोटे छोटे, they represent the focal area of bacterial collection. Okay, that's all for today's class. We'll be starting with the diagnostic work of histopath and treatment plan in the next class for CSO. Till then, like, share, subscribe and comment. Bye.